The emergence of a fake CDC vaccine safety website, closely mirroring the official government site while spreading misinformation, is a deeply alarming development in the ongoing battle against vaccine skepticism. The fact that this fraudulent site was linked to an organization previously headed by Health and Human Services Secretary Robert F. Kennedy Jr. raises serious concerns about both the integrity of public health messaging and the broader implications for vaccine confidence in the United States. This deception was not a simple case of misinformation, but a calculated effort to mislead the public using the trusted branding and authority of the CDC. The implications of such an effort go far beyond a single misleading website. It represents an escalation in the war against scientific credibility at a time when vaccine hesitancy is already fueling dangerous outbreaks. The fake website, hosted under the domain realcdc.org, was designed to mimic the official CDC vaccine safety page in almost every detail. It used identical formatting, official logos, and even linked to legitimate CDC social media accounts, making it highly convincing to unsuspecting visitors. However, beneath the familiar surface, the site was filled with misleading claims, including disproven allegations about vaccines causing autism, as well as emotional testimonials from supposed parents claiming to have regretted vaccinating their children. This kind of deception is particularly insidious because it exploits the trust that people have in the CDC while steering them toward false and potentially harmful conclusions. The revelation that this fraudulent site was linked to Children's Health Defense, CHD, an anti-vaccine organization Kennedy led before his presidential campaign, raises serious ethical and legal questions. CHD has long been a hub for vaccine misinformation, using its platform to cast doubt on the safety of childhood immunizations despite overwhelming scientific evidence confirming their benefits. While Kennedy himself ordered the site taken down after media scrutiny, the fact that it existed in the first place and was only removed when publicly exposed suggests a deliberate strategy of misinformation. Even more troubling is that this incident coincides with Kennedy's push for a large CDC study to reevaluate the debunked link between vaccines and autism, an idea he has promoted for years despite conclusive evidence proving otherwise. The concern is that by keeping this conspiracy theory alive at the highest levels of public health leadership, Kennedy is lending legitimacy to dangerous misinformation, potentially weakening public trust in vaccine recommendations. The timing of this deception is especially disturbing given the current measles outbreak sweeping across the country. As of last week, 378 measles cases had been reported across 17 states and New York City, already surpassing the total number of cases from the previous year. Public health officials are warning that the outbreak could persist throughout the year if it is not quickly contained, a situation made worse by the growing number of unvaccinated individuals. Measles, a disease that was once nearly eradicated in the U.S. thanks to vaccines, is now resurging due to declining immunization rates, driven in part by the very kind of misinformation spread by organizations like CHD. This is not just a public health crisis. It is a direct consequence of the erosion of trust in vaccines. The existence of the fake CDC site also raises alarming concerns about the increasing sophistication of anti-vaccine propaganda. In the past, misinformation largely circulated through social media and fringe websites, but this case represents a new level of deception, one that blurs the lines between official sources and fabricated content. The use of real CDC branding, familiar layouts, and official-sounding language makes it nearly impossible for the average person to distinguish truth from fiction. This is not just a problem of misinformation, but a direct attack on the credibility of public health institutions. If people cannot trust the CDC's own website without fear of being duped by an imposter, how can they make informed health decisions for themselves and their families? Even though the fraudulent website has been taken down, the damage may already be done. People who visited the site before its removal may now be convinced that the CDC itself has acknowledged vaccine dangers, an idea that will continue to spread through word of mouth and social media long after the site's disappearance. This is a common tactic in misinformation campaigns. Even when false claims are debunked, they leave a lasting impression, planting seeds of doubt that can persist indefinitely. This is precisely why public health experts warn that combating vaccine misinformation is not just about correcting falsehoods, but preventing them from taking hold in the first place. This incident underscores the urgent need for stronger regulation and oversight of digital health misinformation. While social media companies have taken steps to curb the spread of vaccine-related falsehoods, the ability of anti-vaccine groups to create near-perfect replicas of official health websites shows that current measures are not enough. The government must take a more proactive role in protecting public health information from malicious actors, whether through stricter enforcement against fraudulent domains, better public education on how to identify misinformation, or stronger penalties for organizations that deliberately spread false medical claims. Perhaps most concerning of all is that this event is not an isolated incident, but part of a broader trend of increasing hostility toward public health institutions. The COVID-19 pandemic intensified distrust in medical authorities, and anti-vaccine groups have capitalized on this skepticism to push their agendas further. If the CDC and other health organizations do not take decisive action to restore confidence, the consequences will extend far beyond the current measles outbreak. Future public health crises, whether another pandemic, a resurgence of polio, or emerging infectious diseases, will be met with even greater resistance, putting countless lives at risk. The removal of the fake CDC site does not mark the end of this battle. It is simply another warning of how far vaccine misinformation efforts have evolved. Public health leaders, lawmakers, and tech companies must recognize the severity of this threat and act accordingly. Without stronger intervention, the erosion of trust in vaccines and health institutions will only continue, leading to more outbreaks, more preventable deaths, and a population increasingly vulnerable to disinformation.